Hello everyone, welcome back to Med Made Easy. Today we're going to talk about a medication called Methotrexate. This is a medication that's often given for rheumatoid arthritis, but it's also given for other conditions like psoriasis and even certain types of cancers. This is an immunosuppressant, which basically means that the drug suppresses the body's immune system so that it basically turns off, or you could put it like it reduces the body's typical immune response. These drugs can make the individual more susceptible to infections as well. I do want to just go through some quick tips of things you need to know about this medication. Let's begin with the first one. It's typically given once a week on the same day of the week in tablet form, but it can also be given in other forms. Tip number 2. Usually it takes approximately 3 to 12 weeks to kick in to see the full benefits of the medication. Tip number 3. While on methotrexate, patients should be also supplemented with folic acid. Methotrexate can cause folic acid deficiency, and generally patients who are also started on folic acid supplementation. Folic acid is essential to the production of red blood cells, and red blood cells, they actually help to carry the oxygen to the body. Tip number 4. Methotrexate should not be taken in women who are trying to conceive. Many studies have demonstrated the potential for this medication to cause birth defects, most often in the skull and also the limbs of a baby. And I have seen some varying answers on when to stop the methotrexate before getting pregnant. I've seen anywhere from 1 to 6 months. Definitely, I do suggest talking with the OBGYN to determine exactly when to stop this medication, and also the rheumatologist. For men, FDA recommends methotrexate to be stopped at least 3 months prior to getting a partner pregnant. If you're trying to have a baby, methotrexate should be stopped, along, of course, with the counseling of your providers that are helping you with this medication. Tip number 5. This medication is excreted by the kidneys. Typically, the creatinine clearance must be at least than 60 milliliters per minute. There is a potential for this medication to cause renal failure. Tip number 6. Methotrexate can cause sun sensitivities. Individuals on this medication will have to avoid prolonged sun exposure. Tip number 7. It is important to monitor for bone marrow suppression. There's different things that you can monitor with this if you see any petechiae, bleeding gums, hematuria, or blood in the stools. Tip number 8. Individuals who are on methotrexate need to limit the amount of caffeine that they use, because caffeine actually can decrease the efficacy of methotrexate. Tip number 9. This medication can cause Stevens-Johnson syndrome. This is a life-threatening condition that starts off with a lot of times flu-like symptoms and can lead into a rash and should be addressed immediately. These are some symptoms and things to watch for specifically regarding this condition and should be reported immediately. Tip number 10. There are different labs that need to be taken at baseline and also regularly throughout the patient's treatment on methotrexate. Here you can see a list of these different labs. Now, this is just a generalization. This may change depending on how long the patient's on the therapy. The intervals might actually of the CBC and the comp panel may be spread out, or they may be done more often or less often, depending on what the lab levels are and if there's certain symptoms that the patient is having. Info tip number 11. Typically, these individuals should avoid live vaccinations. Because methotrexate is an immunosuppressant, it does make the individual more susceptible to infection, thus the reason why live vaccinations should be avoided. Of course, these things should be discussed with the provider who is taking care of this patient. Pneumococcal and influenza vaccines are not live vaccinations, and they are highly recommended to be given in these patients. Info tip number 12, and this is the final tip for today about this medication. This medication can cause pulmonary toxicity. It is a potential. So the individual should report any symptoms of a dry, non-productive cough, shortness of air, dyspnea with exertion. These individuals may also have a fever as well. Pulmonary abnormalities are revealing to be a common major toxic effect as a result of methotrexate therapy. Some clinical trials have shown that there's actually a higher incidence of pulmonary toxicity in patients who are on this medication for rheumatoid arthritis than with those patients who are on it for psoriasis. Pulmonary toxicity is also associated with a divided weekly dose regimen rather than a full weekly dose regimen per AAFP. This is why a baseline chest x-ray is so important. According to AAFP, x-ray abnormalities that happen related to methotrexate include interstitial alveolar infiltrates, hilar adenopathy, and pleural effusion. Also, other things include worsening of existing fibrosis, scarring, and also honeycomb changes. Well, that's it for this video, everyone. Thank you for watching. Hope you enjoy this kind of video. Make sure to give this video a thumbs up if you like these kind of videos, and also hit the subscribe button and the notification bell so you get the latest videos. Take care of yourself.